My name is Malisa Rasakanya. I'll be the program director for today's conversation on men's health. Without wasting much time, Mr. Gariso Mekwa, the floor is yours.
Thank you so much, Mr. Rasakanya, and I'm very much excited for this opportunity to be welcoming and outlining the purpose of the day to our attendees, to all our students, our esteemed guests. Firstly, I just want to welcome and the esteemed guests, which are our students, our males, our men in society, our brothers, to say you are mostly welcome. This is specifically for you. I know that there's very few occasions where there are events specifically focusing on you, but today we thought let's dedicate this day to you for our men's mental health. July is regarded as mental health month, so mental health affects everyone, men and women, but today we want to focus on men because we realize that men are the most vulnerable in terms of suicide rates. When we check statistics, it tells us that there's more men who commit suicide than women. So we want to welcome our students to say, please come and learn. You heard the lineup of our speakers. We have medical doctors, we have financial advisors, we have everyone, and take as much notes as possible. After every presentation, I believe the presenters will also share their contact details, but you can also contact the student counseling in the Gauteng region, then we can be able to assist you. To our esteemed presenters, we welcome you so much and thank you for taking out your special time just to focus on us and dedicate this opportunity to share knowledge that you have with us and with our attendees. We really appreciate and may you continue to prosper in your industries. We ask that feel free to share whatever knowledge that you have. Don't leave anything out. You can be harsh as possible. You can tell us the painful truth that we don't want to hear. We are ready for it. And to my students, my colleagues, I encourage you, let's take notes, let's take contact details there, let's network as well, because this is the opportunity of a lifetime. So without any further ado, I want to say, please feel free. In Setswana or in Sesotho, they will say, "Dimpia di bofilwe," meaning that there's no harm that you should expect. Lentole aina bungozi. Ithathele. So we're asking you guys and ladies and gentlemen and our doctors to feel free and see us as your clients, see us as your customers, and then we hope that we will be your future clients and patients. Thank you so much, and God bless.
Let's welcome Dr. Aijin, who will be presenting on medical awareness. Dr. Aijin, the floor is yours.
I'm a urologist. I've got a special interest in many cancers, and in particular, I treat a lot of prostate cancer and all other urological conditions. So I was asked to give yet another brief broadly on prostate cancer, and I'm going to be talking more like why do we get it, who may get it, how does it get diagnosed, and then treatment options. So who gets it? Men. You have to be a man. When we speak about the prostate, we speak about a normal part of a human man. We are born with this. It starts developing from puberty when the Adam's apple start to develop and our voice breaks. That's when the prostate starts developing. It carries on to grow with us until the last breath. And throughout our life as men, we may have different diseases of the prostate, starting from things like irritation only, and that could be related to different chemicals or the acidity level of our urine. There could be infections that affect the prostate. In that instance, the urine might be burning, very painful, and you may have severe fever, like somebody with what traditionally people call man's flu, a very bad feeling of a horrible flu with high temperatures. You're feeling hot, you are feeling cold. In those instances, you will know that I'm very sick and you need to go to the hospital for that. Subtle prostate diseases will include just the change in the pattern of the urine stream. You may notice that as you grow older, for those who are already over the age of 40, the urine start flowing too far, and then it starts coming closer and closer to the shoes. Sometimes you stand there for a while before you can pass urine, and then only after that you get a flow, or after you've done passing urine, you get the droplets of urine coming with what we call dribbling, and you have to be shaking a little bit harder just to make sure that you don't stain the undergarments or the outer garments if you are underwear less. Come the cancer. Usually, for majority of men, this is only a concern after the age of 40. Usually, if you are going to get prostate cancer before the age of 40, it's one of the rare anomalies. It's super aggressive, and unfortunately, there is not much today within medical health that we will do to really save that. We may try, but we get very aggressive subtype of cancers. If it was to happen when you are younger, it's a rare exception. So the general guidelines in South Africa for African men is that if you are a black man, get your PSA tested from the age of 40. If you are a white man, from the age of 45. And that is for the South African Urological Association guidelines. If you look at international guidelines, you may see a different recommendation, but usually even the Americans will say for a black Americans, they want to test them from the age of 40 if they are going to test them. Now, there are debates on whether we should be screening and testing for prostate cancer. And I usually say that is the problem of the very developed world, where people feel like there is over-testing, over-treatment. Unfortunately, in South Africa, we are probably 2 decades behind that debate because there's lots of circulating yet to be detected cancers. And those are the problematic cancers. The reason they are problematic is because you don't have symptoms early. You are not sick. You just your normal self. And one day you go to the doctor, they like, you are over 40, you are over 50, let's do your blood test, and voila, there's problems. Up until then, you felt nothing. And that's for the majority of us. You do not know until it's late. The reason we get cancers over and above being a male could be habits, heavy smoking, use of drugs, immunosuppression, and of course, who you are born to, family history. Those are very important. The lifestyle diseases and lifestyle habits, most of us can do much about it. So maintain a good body mass index, do exercise. Please, if you can, don't smoke. And possibly, please don't use drugs for whatever reasons. If you've got an immunosuppressive disease, including retroviral HIV, including sugar diabetes, or heavy asthma where we need to put you on high doses of steroids, frequent the doctors who are treating those to also assist you with checking, but do take treatment to control your chronic illnesses, and usually you'll do fine. It's important for us to profile our families. Prostate cancer runs in the family. So from both maternal and paternal sides, we can pass the genes for developing prostate cancer later in life to our offspring, to our children. So the story that Gogo passed on because next door, we must be a little bit more direct to family and honest with each other to say, Mama had cancer, Grandma had breast cancer, Grandpa had prostate cancer or colon cancer or anything, and try to move with that, and it will help the family a lot. Because if any of your family members, your blood relative, get prostate cancer before the age of 55, chances are it runs in the family. And therefore, you are at a slightly higher risk than people who doesn't have prostate cancer in their family genetic makeup. You have to get checked early. By the time you get symptoms from prostate cancer, majority of the time, it is too late. So what we recommend gentlemen do is from the age of 40, please visit even your general practitioner, and they will be able to do initial profiling and assessment and pass you to the urologist if they realize that there are concerns, or if they feel like they are not well trained to do a full assessment and to reassure you. But a local clinic for those without medical aids, a government hospital, a general practitioner, and of course the specialist, the urologist. Your physician, your internal medicine specialist, the guys who help us with our diabetes, the high blood pressures, our asthmatics, are also able to do initial screening for prostate cancer and then pass you on to the urologists. Where we come in is either for screening for those who didn't get screened earlier, or we will then preferably see somebody who's already screened to come and discuss your individual risk profile and discuss options available to you going forward. So preferably you'll have a blood test done, which is a small little chemical in our blood called PSA. It stands for prostate specific antigen. It's a protein or a chemical coming from our prostate gland. And as we grow older, the level of that chemical also rises in relation to our age. So it is age specific. And therefore, we will look at your age, we will look at your PSA, we check your family profile, we check if there are any symptoms that we have. We may do other tests, including a digital rectal examination and or MRIs, which are the scans for the prostate, very expensive scans, these MRIs. So most gentlemen will end up with a digital rectal exam, an ultrasound, and a PSA, and we'll get a very good clear view of how we should help you going forward with that information. Let's say something is not right. The recommendation will be to take a sample from that prostate in theater or in the rooms using a needle, and this needle suck a small strip like a tiny spaghetti from your prostate. It gets sent to the laboratory, they will assess it, and they'll give us information about that prostate. That information, if you have cancer, will include what we call the grade, meaning the aggression of the cancer, and how much of that cancer is there within that prostate. We will then sit down with you if unfortunately you have cancer, discuss how do we go forward to doing what we call staging, meaning how far is the cancer advanced throughout the rest of your body. And with that staging, early stages, different treatment, late stages, different treatment. Now, without going into detailed specifics, early cancers can be treated with surgery and radiation, which is called radiotherapy. And that radiotherapy could be seeded, where we put small seeds, it's called brachytherapy, or it could also be external beam, where the X-ray is lit like from a torch through to the body to kill tumor or cancer cells. When we do surgery, we can do open surgery to remove gland, or we can do telescopic surgery, which means normal laparoscopy with telescopes held in the doctor's hands, or using robotic machines where we operate a small little medical robot to remove this prostate glands. The pros and cons of the surgery, what to expect, the life changes of treatment, I will skip that. They are very much individualized. And I'll give you an example why I'm saying that. You may have a gentleman who is otherwise a priest, who has pledged that they are going to be not engaged in sexual intercourse. They are going to be celibate. And those gentlemen won't be awfully concerned about erections and erectile functions after treatment. You may get a newly wedded 42-year-old gentleman who now has got a prostate cancer and a youngish bride, maybe she's in the 20s. She still expects a lot of the other marital benefits, and therefore erections are very important to that patient. As much as a 73-year-old gentleman who the granny is maybe late and he's not concerned about his erections anymore. However, treatment of prostate cancer affects erections, it affects our control of urine, and there are treatment for those. A detailed discussions with the consulting doctor is usually recommended. If the cancer is too advanced, unfortunately, you may now need to undergo chemotherapy, hormone treatment, and sometimes what you call immunotherapy. These are advanced cancer treatment with side effects, but are also life-saving. So certain things will change. Unfortunately, if any of us is diagnosed with cancer, some things are going to be changed permanently from the psyche, once we tell you that you have a potentially life-threatening disease, to what is expected after treatment, which I like calling eventualities of treating you. So, for example, once the prostate is removed, even if the erection is okay and you are continent, when you become intimate, you will never ejaculate. You're going to get an orgasm, but you are not going to ejaculate anything, and that is permanent. So those are eventualities, and there's just not much that could be done. We have pros and cons. We have to balance the benefit of treatment to the risk to your life. And then, of course, it's a shared decision-making process with the patient, the spouse, families, etc., to agree on how best to go forward with this. So this summarizes prostate cancer in a nutshell. I would like to leave some time for some questions, and then it becomes a little bit more helpful to direct. And thank you for the attention. Okay, I see some questions say, how does diabetes affect men? Yes, in many things, as it affects all human beings, but specifically to men. If you are diabetic, the question is that, is it well controlled? If it's well controlled, you are fine. Just keep it well controlled. All the other diseases that you will have are similar to any person who is non-diabetic. Now, if you don't control it, you call vascular injuries. You get what endothelial dysfunctions. This is how your blood vessels work and react, how your hormones react. And then you can get many, many diseases, from heart attacks to kidney failures, to losing your legs, to erectile dysfunctions, and the list goes on. And you could also pass on and die from what should have been a very simple infection. So it's very important that if you do have diabetes, please get it controlled. So this cancer prevents chances of having Osprey's. Yes, Mr. Jacobs, if you have prostate cancer and it's been treated, the odds are that you may not be able to conceive naturally. Therefore, if you think of after treatment, can I have sex and impregnate somebody? No. But can you use assisted reproduction techniques like in vitro fertilization, intracytoplasmic sperm injections, which can be discussed together with the fertility specialist? You can still go on to still have children if you are healthy enough to see them grow, and hopefully you will be able to. Does that mean you won't be fertile since you won't ejaculate? Is the same one. It is answered. You are not naturally fertile, but we can assist with assisted reproduction techniques so that one can still have babies. The orgasm is the same. So the sensation of people who have had prostate cancer and how they enjoy and experience sex is the same. What we have is people complaining that, no, because now I can't spew sperms anymore. Sex is no longer that good. And I ask them, but if you've used condom, you've just spewed them in a little tight plastic and you're still having joy anymore. So that one is really a mental state. It's not a reality of medical fact. How accurate is the prostate blood test versus physical hand testing? Both of them are supportive of each other. It's a continuum, meaning that we cannot do all. We have to do both, and then preferably, if possible, do specialized x-rays called the MRI of the prostate gland. Makoba was asking, what are the symptoms of prostate cancer? And usually nothing. Like I said.
Charles is asking, what are some of the general foods we can consume to prevent prostate cancer?
Not much. There's a lot written. A lot of it is not based on pure science, But if you eat according to what is written, if you were to Google good food for prostate, it's healthy eating. So I do promote healthy eating, and I'll support that. Do eat healthily. What we know could assist when you eat now in tomatoes and carrots, but you must be taking it for a long time, over many years. Don't take lots of high doses of these substances, because after a while you can't take them. So do eat a bit of tomato sauce, and then the rest, it's good healthy eating. It's very important. Mediterranean diets tend to work for a lot of things, supposedly. So I will also do support that.
My question is, Prof, I've already answered it. I wanted to ask what to avoid, what not to eat to prevent the cancers. But he have actually answered. He said we should avoid too much of tomato sauce and carrots.
Yeah, very importantly, just as a follow-up, processed meat is known to be associated with a couple of cancers, colon cancers, prostate cancer. And you should also go easy on the red meat, especially dried red meat. So that's why I say Mediterranean diet, fish, lots of vegetables, olives, avoid saturated fats. But usually just check with your dietitians. Most of them are quite conversant with this to help. But even nowadays, information is just available on Google. The evidence is really very strong for leukopene. The rest is associated with that.
You started by saying you were doing circumcisions at this point, and I was interested in with regards to that. But there's about 14,000 that one has to put aside if the medical aid isn't able to pay. The benefits and the availability, can you shed some light on that, please?
Yeah, it's a very good question still. Look, there are many reasons why people do circumcisions, and usually at the end of the day, we have to work to the individual ones. You can be religious, they could be cultural, and they are medical. And I'll stick to medical. I'm not going to address the other ones. Medically speaking, for hygiene, the foreskin, which is the little skin covering the penis, should be able to go back. And usually when you got a boy child, you must gently over the years try to see with gentle pull when you bathing them, so that you are able to keep good hygiene and cleanliness under the skin. Otherwise, it builds up this sticky, creamy white material called smegma. Now that smegma is spelled S-M-E-G-M-A. S-M-E-G-M-A. This smegma can cause irritation. You can get infection of the foreskin. It can be difficult to wear. You can get scarring inside there if you get a very bad skin. So that's one thing that circumcision helps about. The other one is to make sure that there were studies that were done to show that there is a reduction in transmission of sexually transmitted infection, in particular human papillomavirus, which we know, and if you don't know, it's associated with cancer of the penis and cancer of the cervix, and also the transmission of the HIV virus, HIV. It has been shown to be associated with that. There are other benefits in the sense that people with chronic diseases like diabetes, they tend to develop a very thickened scarring of the foreskin, and that can lead to recurrent infection, poor emptying of the blood. And of course, there's choices and other cultural and religious, which I would not discuss at this point. So those will be, in a nutshell, the reasons for doing circumcisions.
Thank you, Doctor. Is there any support from the government or options with regards to doing it besides like a 14,000 rand?
Yes, last I knew, the government had full programs of they call them MMCs, male medical circumcisions, and they will contract service providers from province to provinces who did that. And I know that there were also organizations, NGOs or non-profit organizations also that were doing this. There's another one, I forgot it because I once gave a talk to those gentlemen, something to do with what outie. But if you just Google, can I get free circumcisions, where are the government processes, a lot of that information is available. Bearing in mind that when the times changes, the ministries changes, the funds get depleted, they may be temporarily suspended. Most medical aids will pay for private. You won't walk into a Steve Biko or a George Mukhari and say, I'm here for circumcision, because they are receiving all these other problems of prostate and kidneys and bladders that they're attending to. So this clinic usually are outsourced outside those centers. But the information is usually readily available from province to province and government to government. Privately, most medical aids will pay for male medical circumcisions.
Moving forward, we'll be having Ms. Buyela Mkhulisi, who will be presenting on men's health.
My name is Buyela Mkhulisi. I'm a professional nurse. I used to work for an organization, NGO, called Anova Health, under the program for men's health. So at the moment, I am just freelancing because we have been doing these programs with UNISA. So I am independently presenting today. And yes, thank you so much for the invitation. I'll try and be as quick as possible, and I'll also questions at the end. Thank you. So, why men's health? I think we have been, we have seen throughout the years, or in the last few years, that there has been such an emphasis on men's health. And I think we've been asking ourselves, why men's health? Why all of a sudden men's health? Men's health is now a national health, South African national health strategy for the Department of Health. It is now a focus simply because we know that when we go into public health facilities, those facilities are full of women's health, baby health, chronic health, but there was no major focus in terms of concentrating on. So the government came with the South African National Integrated Strategy on men's health, which had a focus to see a shift in terms of men seeking health within a period of 2020 to 2025. So in the past 5 years, the government has had a focus to elevate or to give awareness or make awareness around men's health. So what is men's health? Generally, the perception is that men's health is only about sexual health. So every time, most times when people speak about men's health, they think of the men and their junk, you know, but it's not necessarily that. It is associated with medical specialty that deals with male health. And with male health, we are talking overall health, your mental health, your physical health, spiritual health, particularly relating to the problems of the male reproductive system. That is the thought that people have. And as we've heard, Doc spoke around urological problems. So we know that, or we've noted within the health system, that whenever men have health problems, they don't access the services unless it has something to do with their genitalia or their urological problems. However, men's health embodies nutrition, health, wellness, grooming, sexual health, and psychological components, and it also overall includes sexuality and metrosexuality. So the takeoff from that, we know that culture and tradition, societal structures has planted that skewed mentality or thought of how we understand and accept men's health and men's behavior, and social construct affects how men seek the behavior on how men seek health. So today for focus, there are a lot that we speak around men's health, but I've decided just to speak around the 5 major components that affect the top leading diseases or mental health. Sorry, the 5 top health issues that affect men around South Africa. So one of the leading ones, or right at the top, is cardiovascular disease or heart disease, also known as stroke. It is one of the leading natural causes of death among men, and these are South African statistics on a global scale. So approximately 1 in 3 adult men will have some form of cardiovascular disease, and each year around South Africa, 450,000 men die from cardiovascular disease. And this is solely linked to smoking, blood pressure, high cholesterol, lifestyle modifications, and a lot of people also don't know that for blood pressure and cholesterol, there's ranges that we need to be falling under in terms of health. Okay, so saying for the focus of today, I had mental illnesses that affect South African men. And among the top, or the first would be cardiovascular disease, or it's also known as stroke or heart disease. This is the leading natural cause of death among men in South Africa, and it affects 1 in 3 adult men globally. So each year, 450,000 men in South Africa die from cardiovascular disease. And this is solely linked to smoking, your high blood pressure, high cholesterol, obesity, and lifestyle issues as well. So a lot of people don't know that we not that they don't know, but a lot of people are not aware that for high blood pressure or blood pressure monitoring, we do have normal ranges that need to fall around when we do health checks. So your normal ranges would range around 120 over 8. So 120 would be your pumping force for your heart, and your 80 would be your resting. So for your heart to be healthy, it needs to pump at a particular force, and this so the second leading cause would be diabetes. Roughly 10.6% of the overall South African population, male population, has elevated blood glucose levels, and nationally about 4.2 million South Africans have diabetes, with forecast reaching 7.5 or 7.4 million by 2045. So in the next 20 years or so, around 7.4 million would be affected in South Africa by diabetes, and around 60% of adult men are overweight or obese. So in diabetes in relation to men, we know that in the community, when someone says to you, it speaks to the male, and it speaks to the male ego as well. So, and that goes to around it for today in terms of men. The third in line, or third highest, is your HIV and TB infections. The HIV prevalence peaks at 27.1% among men aged 45 to 49, 12.7% among the 35 to 44 age group, 12.5% among the 25 to 34 age group, and 4.1% among the 15 to 24. One of the reasons why the age group 15 to 24 would have less is that we find that they are more informed in terms of sexual health and STIs, and a lot of the men, a high number of men within that age group 15 to 24 would have been exposed to PrEP, which is a pre-exposure to prevent AIDS among men. In South Africa, about 7.7 million people living with HIV. Out of those, 12% are men. I've said this, many men are missing out on PrEP, And even worse, with the uncertainties of the funding, we know that PrEP given to HIV antiretroviral therapy, and a smaller proportion of allocated for PrEP. And even among the provinces in the public health spaces, we know that our province also still not offering PrEP as a prophylactic treatment for men. TB and HIV continue to combine as a leading cause of mortality among men. And the relation between TB and HIV is that we know that a lot of, in terms of TB, men get affected by TB by virtue of the work that they do. A lot of men in as well, where they also exposed to these chemicals and that predispose them to infection, especially respiratory infections. And lung, spoken about prostate cancer, lung and chronic obstructive pulmonary disease is by virtue of the work that men do. And also prostate cancer is the most common cancer in South Africa. 130,000 men are diagnosed with 4,100 new cases, and roughly 5 deaths per day. Overall ranks number 8 cause mortality. The respiratory cancers and COPDs are elevated in males. Men are more at risk than women, and also due to the types of occupations that they find themselves exposed to. Of late, what we've also noted is that there is a high rise in oral cancer, with 13.1 per 1,000 capita high in colored men, followed by 9.1 in Black communities, and a certain portion of white men as well. With mental health and suicide, we know that there's a high rise of suicide attempts around men. And this is also just linked to societal expectations and also the economic demands mostly. Lifetime mental illness among adults is approximately 30%, with severe disorders of 16.5 men, 16.5 of the population affected being men. And men account for 10,861 of the 13,774 suicides in the country. And these are statistics for 2023 only, which is about 78.9% of the overall suicides for 2023. Suicide is the 4th leading cause of death among men, 15 to 24. The studies show that the societal pressures and societal expectations become high, with peer pressure and economic strain and societal pressures and expectations for that age group. And most mental health issues stem from depression, PTSD, substance abuse, and occupational stress in high stigma environments. One of the most common infections that common ailments that I decided to add of the 5 top ailments among men is sexually transmitted infections. And I've added this not because we see a lot of men reporting to the facilities due to STIs, but we see a lot of men reporting to public health facilities late with sexual transmitted infections. So women, by virtue of societal grooming, for lack of a better word, women just go to the clinics They have a headache, they go to the clinic. They have slight pain, they go to the clinics. Men usually do not attend until there is, they possibly think they are going to die, or they think that they can now not treat themselves at home. So sexually transmitted infections are seen at a later stage of treatment of inception among men. More men, 17%, report having multiple sexual partners than women, which is about 5% of women will say they have multiple partners, and 17% of men, which is high. And this puts men at a greater risk of HIV infection. 7% of men aged 50 to 49 have had 2 or more sexual partners in the last 12 months. HIV as a chronic infection or chronic ailment must still be taken and be noted that it is mostly a sexually transmitted infection. So until we see HIV as an STI, our urgency to test and treat becomes very minimal. And this becomes one of the main concerns related in the 5 top ailments for men. Common STIs among men are syphilis. So syphilis, fortunately or unfortunately, is one of those sexually transmitted infections where it manifests itself within the first 3 days. And by the time you get to day 8 and you want to go and test for it, the symptoms might have disappeared. And once you acquire syphilis, it does not get out of your system. So you might go and test, for example, when they test you for syphilis, the results will come back and say it is active, or it will come back and say it will just give a number. So it's one of those STIs that you can test, it remains, and every time there is a trigger, then it becomes infectious. HPV, or human papilloma virus, is also one of those silent infections that we acquire. HPV 16 and HPV 18 are the ones that are responsible for creating or developing cancers. So cervical cancer in women, or cancer among all of us actually. And one of the but for us to do blowjobs, and you can have the infection, and it'll only manifest 10 to 18 years later without you knowing it. And it might come as starting off as a small irritation, until when it is tested, you discover that you've got cancer in the throat. The same way as if you would get your cervical cancer, you might get exposed at age 16 and you only discover it at age 40. Gonorrhea is your most evident sexual transmitted infection. It's the one you will get to your church, clear yellow, just the most evident one, and that people take for treatment. However, what we've also noted is that you can get your STIs in the mouth without knowing. So you give someone a blowjob, you get the infection in the throat, it manifests as throat irritation, eventually as a cough, but when you are given antibiotics or the normal antibiotics that you give for a cough, cough does not resolve. So until a specimen is taken or a throat swab is taken to the lab and you are treated as per STI syndromic. So STI syndromic is treatment that you give in public health to treat a blanket of STIs. So it's not specific to one STI. So you get your injection, you get your oral in a form of antibiotics, and it has a blanket of STIs that we might not necessarily have a name for. So these are the most common ones that we have. Insights and recommendations on what we can do. Lifestyle modification. So we know that there is a reduction in terms of smoking the actual cigarettes, but there is an increase in terms of people smoking e-cigarettes. So yeah, there's an increase in e-cigarettes, and as much as we know that we are reducing the tar and we are reducing the exposure to the lungs, but the lungs still consume a lot of that nicotine that comes via vaping. Reduction in drinking and unhealthy eating is vital. Regular screenings, so blood pressure screenings, blood sugar screenings, cholesterol, HIV testing, STI screening. This one is not a basic that you can do in the public health space. However, if you've got medical aid, when you do your annual or your biannual screenings, you can request for your doctor to do a syphilis test, to do an HPV screening test, inclusive of in your blood work as well. Prostate screening and cancer checks. We need better mental health support. Our brothers and fathers out there need to belong to a particular community where they speak around reducing stigma around mental health. This notion that boys don't cry, tigers don't cry, is the one that is making a lot of our men not to go out to seek help. And we are missing a lot of men that are not catering to their psychological health due to stigma. So we need to reduce the stigma. We need to increase access and early intervention in terms of us promoting mental health. Public health action. There is targeted campaigns that are out there. So everywhere we go, we know that HIV testing campaigns are there, but we also need to take caution in terms of access to these services, reduce the stigma in terms of when there is a campaign around GBV. Let's not only do that when there is that campaign. Let's join every other campaign that is there, so that we demystify the trends that are negative towards men. And I've spoken around the South African National Integrated Men's Health Strategy. I think men need to familiarize themselves around those strategies, and also give input in terms of writing policies around men's health, so that the health system or the government can better improve services for men. At the moment, there is a campaign around Mpox. Mpox is monkeypox. It's mainly targeted to around men, and especially men who have sex with other men, and also the HPV campaign. So for us, they are out there who are parents. We know that the government is giving free HPV vaccines for girls, but we need to lobby as men to have an HPV vaccine given to our young boys as well. Remember, HPV, if you acquire it at 16, it will only manifest itself as an ailment or as a cancer 20 years later, 10 to 20 years later, and you might only discover it in your 40s. So the campaigns around HPV are around women, young girls, but can we lobby for young boys as well? If you've got medical aid, you can always request your doctor to give an HPV vaccine to your young boy. And for us that are parents to young girls, can we also young girls, because if they acquire HPV, they can easily give it to our young girls or to men as well. So it only not just benefits the girls, but it benefits the whole cycle between boys and girls as well.
What is the biggest misconception people have about men's health mentality? And then I think we can combine it with this one because they're almost the same. Why does society often treat men's health and mental health as less important?
I wish men on this forum answer that, but the men are socialized into being strong, even in instances where so especially in a mental health. Remember, I'm not sure of the people that are here who in demographics, that many that grew up in the townships was not labeled as a health. But we knew that when someone is when you're speaking around mental health, you're talking about people that are out of, I don't know who has a word for it, but people that are crazy, that are institutionalized. So people that are in your mental hospitals. So when you are speaking mental illness, it's the most extreme that people think about, the violent one, the crazy ones. So we are not talking about our minor depressions. We are not talking about our over drinking. We are not talking about our anger issues. We are not talking about, there's those things that are not regarded as mental illness or mental imbalance, for lack of a better word. So the misconceptions are there because there are those spectrums of mental health that are not regarded as mental illness or mental imbalance. They are regarded as a sort of a strength for men. So men are supposed to be strong, men are supposed to be brave, men are supposed to be protectors, men, all these butch type of stereotypes that are out there are labeled for men. So even when a man feels they cannot be the strength of the community or of the household, it is then regarded as a weakness. So we need to come to at an angle where weakness is not seen as a bad thing or a vulnerability per se, but as a cry for help. And if we start small, or when we start right at the bottom of, or at the beginning of the cry, then we can better manage and balance the mental part of a human, of a man. I'm not sure if I've answered well for the guys. Sometimes it's a bit difficult to answer because there are just so many facets to it.
Yeah, thank you so much, Sisbi. And I think I agree with you. Some of the questions that you need to ask yourself those questions. It's introspection to say, okay, fine. Me as a man, what am I doing, for my holistic health? Whether it's mentally, financially, physically, and all of that. All right. Thank you so much. So there's another question here on the chat. Does masturbation affect men later with the possibility of cancer or infections?
No.
Okay. All right.
Simply because most genital infections have to before, mostly, it's just the chemical pH.
Okay.
Depending on how often it's done, it can become, and also depending on the force that is used on the shaft, as a constriction. Yeah, constriction, but mostly no, it does not cause any infection. It does any people speak around an addiction.
Okay.
Thank you, Ms. Buyela Mkhulisi, with the presentation again. So our last speaker is Mr. Oratile Thabane, representing on financial wellness. Mr. Oratile Thabane, the floor is yours.
My name is Oratile Thabane. I'm a financial advisor. I'm an investment manager. I'm a key individual. I wear a couple of hats in my profession, but that's something that I'm seeing that this new world is making space for us to be able to have multi-faceted careers, in that you don't only wear one hat, you wear quite a few hats going into the world. So Gloria asked that since we spoke last year, she asked that I speak on three main topics that I'll be discussing today, and that's debt management, wills, and investing and saving. Of course, financial wellness does not only encompass those three, but I'm just narrowing it down just so that we can have a discussion as to all three of these aspects, because I know that there's likely to be quite a few questions that come about. So I'm going to touch on the first area, and that is debt management. As much as we are students and whatnot, this is where we actually start to build our, what would one call our credit scores, in that, so later on in life, you're going to use credit most likely to purchase a house, purchase a car, or anything like that, unless we're blessed to have enough wealth to be able to do that without needing to use credit. But mainly debt management is that it's something that you need to put in place early, so that you can nip anything in the bud going forward. And that entails having a budget. And if it's not necessarily a budget, you must at least know where your money is going at the end of every month. So that just entails keeping an eye out on your bank account, if money's coming in, where it's going out, when it's going out. If you do have debt, like for example, so in my experience, I actually started with my first account was a Mr. Price account, actually. So they had activations at school and whatnot, and they were saying, "Oh, you're a student, we can give you like 1,000 Rand worth of credit, and then you can get some clothes off of that." So for me, my journey started in that Smolayana account with Mr. Price. So I'm just alluding to the fact that you don't necessarily always have to have a regular income in order for you to access credit. But you need to be on top of it as much as possible. So if you're getting, say, maybe a stipend from home or some pocket money from home, you can use that as your income, sort of that. You are a student, you're not working yet, but that can be seen as your income. But like I'm saying, you need to keep your eye on it so that you know when, how much is due, etc., etc. So there's also the opposite effect of sometimes you might have too much debt in your portfolio, and there's a specific not specific. There's a a way that you can manage your debt. If, for example, you have 3 accounts, one account owes 100 Rand, the second one owes 200, and the other one owes 300. So meaning every month that you're paying towards these accounts. It's called a snowball effect, in that you look at which account has the highest interest every year, because that's where you're going to be paying the most money to. And then you look at actually putting as much money on that one until it's closed. So for example, in my example, I had said that you've got 3 accounts, one worth 100 Rand, one worth 200, and the other worth 300. If the 100 Rand one is the most expensive one wise, in regards to interest, so you would tackle that one first. And once you've closed that account, in other words, you've been paying off that 100 Rand, for example, let's say it's over a year, and you close it after a year, you should actually take that 100 Rand that you used to take to the closed account to the second account. So as I was saying, there's 100 Rand, 200 Rand, and a 300 Rand one. So now you're going to take that 100 Rand and put it to the account that you're paying off 200 Rand. So then now you're actually paying 300 Rand towards it, which means you're paying extra, which means that you actually get to close it quicker than what you usually would have to take. So it's just one of the methods that you can use, called the snowball effect, that you can use to close down, to manage your debt and get off debt as soon as possible. Okay. Nipping that in the bud. I'm sure there's questions about that, but we can address them as we go. And then the second area I'm going to talk about is drafting a will. It's really important to have one in place, even as a student. So the fallacy that I hear mostly when I chat to clients, they say, but I'm not rich. I don't have any assets or anything like that to give away. Granted, but wills are not only for rich people. Your loved ones need to know what to do with your belongings. At some point, even as a student, I'm sure there's a magazine that you've bought. I'm sure there's accounts that you've opened, the Facebooks, the Instagrams of the world. We need to know what to do with those, how to close them down, because if they stay open and whatnot, you're subject to people scamming people, etc., etc. So it's very important to have a will in place, even if you are a student. And oddly enough, in South Africa, we have a National Wills Week that's actually coming up. And it's between the 15th and the 19th of September. The Law Society of SA, the LSSA, they drive this initiative to try and get people to just draft their wills. And usually the law firms that are part of the society, they actually draft the wills for free. So you don't have to pay an upfront amount in order to in order to draft the will. There is, however, how they usually do it is that they ask you to appoint them as executors. And what an executor does is essentially they make sure that your estate is wound up using what you have in your will. So in other words, if you say you must close all your digital accounts and you must give $50 to my mother, they have to make sure that your estate is actually liquid enough to actually provide that. So if you pass away intestate, if you pass away without a will, that is seen as you passing intestate. So the Interstate Succession Act will then kick in that the court will then decide to appoint an executor. And an executor is a person that's supposed to at least know who you are and what your wishes are should you pass away. The problem is that your assets might not go to where they need to go. Although the Interstate Succession Act works in a way that your spouse and your children will get your benefits, your siblings, your parents, if required, maybe extended family. but it's not always equally based, or you might not agree on the percentages that who would want to get. And the other caveat as well is that it can take a long time to appoint an executor because there's backlogs firstly, and just working with the state, unfortunately, sometimes can take a while. And also there can be extra and unnecessary costs that are put on your estate once you pass away if you don't have an executor appointed. So another thing as well is when you do draft your will, so it's not only law societies that are pushing the Wills Week, it's actually also banks. Usually most of us all have access to a bank account, and usually banks do offer wills. And with that said as well, they do structure it such that they are the executors. But if possible, wherever possible, you can speak to the bank and say, okay, you can be the executor, but I would like to have a co-executor. So maybe someone that you trust, your parent, your sibling, your uncle, your aunt that you trust for them to act in your best interest. So you can say, okay, the bank will be my executor, but they can co-execute with my uncle, for example. So it's not a hard set rule that the bank has to be the executor. You can actually negotiate and say, I would like you guys to do it, but please do it alongside my aunt, my uncle. Okay, that's the will section. I'm going to speak about what everyone always wants to speak about, and that's investing and saving. Firstly, I'd like to start to say that there's actually a difference between saving and investing, because sometimes we can get it confused, muddled. But in simple terms, saving is for short-term goals. It's for your emergency fund. It's for if you want to buy a pair of sneakers one day and they're $2,000 and you've got 200 Rand that you want to put away. Then you say, okay, I'll put 200 Rand for 12 months. For 24 months, and then I'll get my $2,000. It's so that should you have any emergencies, you can use the savings in order to supplement what you need to save for. So investing, it's more for long-term goals, like a deposit of a car, a deposit of your house. And with that, you need time for the funds to actually grow. So that so I started with saving so that if you have an emergency fund, you don't have to touch your investments because they need time to grow. And every time that you pull out money from your investments, that actually disrupts the growth of that investment. So as much as possible, you need to put investing aside from saving. So it's two different buckets that you can look into when it comes to investing. I would say because I'm a financial advisor, you should always go through a financial advisor for investing, but there are ways to do it by yourself. There's 3 different types of vehicles that you can use to actually invest in. That's investing in shares directly, that's investing in unit trusts, and then also using EFTs. EFTs being they're similar to unit trusts, except they are structured that fees-wise, they are more effective to be using rather than unit trusts. And sorry, I'm using jargon here, EFT, Exchange Traded Fund. That's what the EFT is. So investing in shares, you can buy and sell shares. There's many platforms that you can use in order to do this. There's brokerage fees that you need to look out for. Sometimes they charge monthly, sometimes they charge annually. That's something that you need to look out for. Hence me saying that it would be better to do it through a financial advisor. And then there's also unit trusts. Those are also investment houses. You can go directly to the Ellen Greys, to the 91s, to the Coronations of the world. You can invest directly with them. And the biggest ETF platform actually in South Africa is actually Satrix, which is owned by Sanlam. That you can also use to invest directly through them. There's also a platform that I have advocated for. Actually, I myself have an account with them, and that's Easy Equities that you can use. And it is the most fairest that I've seen out there, in that there's no minimums, there's no, like you can put in 5 Rand, you can put in 10 Rand, you can put in 50 Rand at any point in time. And it houses all of these unit trust shares and ETFs that you can use in there. But always better to always discuss it with someone in the field, at least, to guide you through doing it. But they do have a demo account, so if you're that way inclined, you can open that and have fun with the demo account, because it's not real money that you use. It's like 100,000 worth of cash, but it's a demo account just to get a feeling on how to invest using that platform. So yeah, that's my piece for today. But what I would like to leave you with is that building good habits now while you're still a student is a good parameter for going forward and handling your finances going forward. Like it was said earlier, the highest suicide rates are amongst men, and one of the biggest talking points is finances. And what I'd like to speak to that is that, guys, please speak to your partner, speak to your mom, speak to your uncle, speak to anybody. Don't keep it all to yourself, because that will cause the stresses that Bui was talking about earlier, the high blood pressures and the stresses towards that. So it would be best to have someone that you speak to, especially about your finances. If you've got a partner, be honest with them. Just tell them like it is. If it's rough this month, it's rough this month. If it's not, then you're all good. And also, since I'm speaking to the student demographic, there's a quote that I keep hearing that's always stuck with me. And it reads, if you are faithful in little things, you will be faithful in large ones. But if you are dishonest in little things, you won't be honest with greater responsibilities. What that speaks to is that starting the good habits now with the little that you think that you might have, it would lead to greater things in the future. So thank you.
My question was, okay, so you taught me something new, exchange traded funds. What was the platform that you mentioned? I didn't get it, that you suggest.
It was Easy Equities, John.
Oh, Easy Equities. Okay, I'm familiar, yeah. So I like Easy Equities. Okay, cool. No, I agree with that. And then what else? So I've got high blood pressure. So I'm a student of psychology and industrial psychology. Hopefully I'll become a psychologist. I'm actually 47 years old, so I've been around the block, you know. So my anxiety, so it's linked to anxiety, and a lot of it is economic insecurity of the future, even though that I you know, if you were to look at me, you would think I'm wealthy, but I'm still very afraid of what's going to happen in the future. I do have my own home and everything. I've just watched a lot of my friends with small kids leaving the country, that's, you know, and these are people that could have paid tax and they could have added value to the economy. So it's of a political nature, I guess. And it just concerns me for future generations. You know, if I don't have you know, if I and it's a race, or the artificial race, but it's a race thing. It's like if I don't have a colored child, the colored child will still be discriminated against. You know, I'm talking about fair discrimination. I know it's a harsh comment, but when is it going to stop? You know, I was born in apartheid, just at the end of it. And I've watched this downward trend of economic impoverishment. And
Sure.
I think they should open it up to get rid of fair discrimination. It's just a hidden type of apartheid. And because we need these people to come back, and we need them to invest in our country, and we need competition, and we need employment. So this poverty, this idealism that's creating, you know, like in 100 years' time, are we still going to have this law? you know, it's just a reverse apartheid. When is it going to stop? So I wanted to throw that out because you guys said I was able to throw anything controversial out there, because it does cause a lot of. It causes a lot of anxiety for me, you know. So that's my question.
I hear you, John, but unfortunately I can't speak to that because I'm not in the political field. I'm not in the legislative field either. But what I can speak to, you did mention that economic, your question is about economic stability. If I can ask, are you okay? Are you sorted in that regard?
Yes, I am. Yeah. So I'm a fan of Discovery. So
Okay.
you know, yeah. Future-wise, no. I've got a company that is dying. We had a 3 million rand loss. So it's basically all our family wealth's gone. But I've got my own wealth, and my mother, who's 70, has her wealth. I didn't start a family. I still can. I know I'm 47. So I actually don't have a lot of pressure that way. I mean, I've already got anxiety. You know,
Jean?
imagine if I had children.
Jean, let me do this, Jean. Can I give you my details, and then we can take this offline, because this is very personal to you. So can I do that?
Yeah, that'll be great. Thank you.
Okay. All right, cool. All right, Sean, I'll do that.
I would like to ask a question with regards to estate management. Now,
Sure.
I currently own a property, and I'm single. I'm still single. So I would like to know what ways do I have, because I bought this property for I've got a son. I got a 14-year-old son. Now, so that if I get married, now, if anything goes wrong in my marriage, and God forbid that my son does not end up on the streets, how can I then protect this estate that I have?
Sure, so Lily, there's a few ways that you can do that. One, before you get married, anti-nuptial contract, you can state in the contract that you have bought this property. Should you guys split for any reason, your son should inherit this property. But first, I want to take a step back. You said you own the property. Is it under your name? Is it under a business? Is it under a trust?
It is under my name.
Okay. So another way that you can do it is either set up a inter vivos trust, that's a living trust, that can own the property. Alternatively, you can set up, if you want, so there's different ways for you to change ownership from yourself to an entity so that it can continue should you either pass away, should you get married, or anything like that. So there's certain ways that you can structure it so that you can do that. So because I would need more information from you in order for you to guide you the right way of doing it. So I'll share my details, and they'll be shared with all of you, and you can contact me should you want to pursue anything further. So Lily.
Yeah, because now the thing is, you know, with partners now,
yes,
are happily in love. Now, when you introduce the issue of prenup and stuff, they're thinking like, you know, this
you're
one,
planning to,
you know.
I hear you.
Yeah. So. Yeah.
Which is why there's the two other options that you can either do it through a business or a trust, which is why I'm saying I would need more information from you so that I can be tailored to your circumstance.
And then with debt management. Yeah.
Yes.
Now, yeah. You have these companies that will call you and they say, what is that?
Yeah. Debt consolidation or whatever.
Debt consolidation in yeah, you know.
Correct.
And is there a difference between debt review and debt consolidation?
It's essentially the same thing. They just use different euphemisms for the same name. But they don't exactly explain to you what it means for you as an individual. Because unfortunately, once you go through debt review, that thing is on you for forever. You're going to find it hard to get any credit in the future. You're going to find it hard to, SARS is going to be more scrutinous on you. So as much as you may have a lot of debt and you need to go through a debt review, they don't tell you the repercussions of doing that. Yes, they're going to reduce their payments. I mean, your payments towards your credit providers and everything. But the repercussions of that for your future is that you're going to have a hard time going forward, especially with financial institutions.
Oh, okay.
Yeah.
Now, I'm not sure whether you are familiar with that guy, Robert Kiyosaki, who says
I am.
Debt is good.
Yes. But
now,
hold on, sorry, just to interject there. There's
Sure.
context to what he's talking about. He was talking about using debt to create more assets.
Sure.
So usually what we find is that we use debt to consume, not to create more assets.
Not to create.
So let me just,
Okay.
yeah.
Yeah, you may elaborate if you may, please.
No,
If you have time.
I'm just saying. So, for example,
Oh.
he uses an example of using credit from the bank to buy a house, which will then eventually be an asset once you've paid it off. Not your primary home that you use for rental. So then you use that rental to pay off the debt, and then once the debt is paid off, that's income that's a asset that is generating income for you.
Okay.
So that's using credit to create more assets for you and your family.
Okay. No. Because the other thing that I also wanted to know is that when do I then get to, let's say I've got a property now, because I hear some people would say, now I want to buy a car. I can use my property as a proxy or surety to purchase that car. Is that possible in South Africa?
In South Africa, it's only if you have the house on an access bond that you can actually use funds from there for the car. But otherwise, it is not.
And there is a question here, which on the chat, I think that a lot of people, maybe they would also want to know about it, because we get these calls a lot from people from debt review, right? So this person is asking, can debt review affect you even after you have cleared your debt?
Yes, it does affect you. So it's essentially, you go through, usually it's a 5-year period, depending how much debt you have. But even after you have cleared the debt, you are still going to get questions. Have you been under debt review? In other words, with every application that you have going forward, especially for finances, you're going to have that what they say record under your name that you have gone under debt review.
Assume there is a co-executor who is a family member appointed. Who has the final say between the bank and the co-executor if the two executors have conflicting opinions?
If you have a will in place, there's nothing conflicting that that would be a problem. It is they literally have to carry out the will as you have instructed. And you can state in your will that should there be any conflicting issues, I prefer co-executor X to have the final say as opposed to the bank. The bank can always suggest to co-executor that this is the best way. This is rather do this way. But at the end of the day, you in your will stipulate if there's any conflicting issues, co-executor or bank should have the final say.
The other question is, if I want to invest through compound interest, where can I go to?
Through compound interest. So, like I was saying earlier, you can use shares, unit trusts, ETFs in order to compound your investment. So, because I don't want to get into asset classes because that's a whole topic on its own. But you'd rather use those either shares, unit trusts, or ETFs in order to have the most amount of what you refer to compound interest going forward.
Okay, thank you. Can I just read this last one before I take hands? How do we access services of a financial advisor? Are they consultation fee?
So it depends. Some may say, okay, for an hour, I'm going to charge you $1,000. But traditionally, financial advisors make their money through the providers. So the product that you decide to put in place with a financial advisor, there's always a fee associated to it. Not always, but you can, and it's a negotiated fee rather. Sorry, you can say, okay, so we're going to put these 3 products in place, and out of them, 1,000 Rand will be paid to me, for example, for putting them in place for you. So it's a yes and no answer in that some advisors, they come to you and say, okay, this is my upfront fee before I even chat to you. And then some say, okay, my fees are going to be generated from what we put in place. So therefore, this is how we're going to structure it going forward.
I'd like to ask if you could come back more at a later time for to teach us in terms of investing for students, some safe investing. I would appreciate that. And also in terms of when you buy property versus in terms of putting it your name versus putting in a trust or a company, is this something doable to an average person? And if I would appreciate to learn more about that. And lastly, how can I improve my credit score just for the future as a student? In safer options, is there options that I can? What if it's very low? Yes, thank you. That will be all. Thank you.
Sure, Hudson. So first you have to find out what your credit score is. So every year you have the ability to get your credit score report from the TransUnion's, what's the other one? So there's various providers that you can get your
ClearScore.
Yes. I was about to say, Gloria. ClearScore is the easiest one because of the interface as well, that you can view what your credit score is. How to improve your credit score, it depends on, firstly, how many accounts you've got, if you pay them on time, if you have missed. So it works against you if you miss any payments towards any accounts. If you use too much debt, for example, you mustn't use over 75% of what you qualify for. There's little things that you can do that you can get your credit score better. I think the first part of your question was if I could come back. Yeah, sure, of course. I can always avail myself to chat about investing in particular. I think I answered your questions, Hudson. Is there another one?
Yes. Thank you. And the last one was, is it doable? Is it doable is it in terms of when you get a property, like putting it in a trust or a company? Is it affordable? Is it affordable and mostly doable for an average person? Yes.
So it's doable. However, there are costs involved because you'll need to get the services of an accountant. You'd need to get the services of a lawyer so that they can draft documents correctly. So it's doable, but usually I see it happening when later on in life, in that because you can afford the accountant, you can afford the lawyer, they can structure everything correctly. But it's best to have those services in place prior to you doing it, because correcting anything wrong that you've done before a lawyer or an accountant is involved is even more of an expense than you starting the correct way.
All right, okay, I see. Thank you. So actually,
Sure.
in the long run, despite the cost, if you can actually sort it out, it's actually to your benefits to
Correct.
go that route for 5 years. Okay, all right. Thank you very much.
Sure.
Okay. Okay, thank you so much. I'm going to take Carol, and divorce will be the last question that we are taking. Carol, you can unmute yourself.
Good day. Hi, so I would just like to know, I'm in my first year and staying with parents still, but I'm considering just the option of acquiring a property that I
Sure.
could rent out while staying here, and it could pay off itself perhaps over some years. What is it even feasible regarding, obviously different profiles of people, but if you earn under 10,000, what are the banks looking at type of situation?
Yes, it's feasible, although the banks are very, how can I say this? They will scrutinize you a lot, especially being a first year, earning under 10K. So the thing is, they might not fund the full amount. They might say we need a 20%, 30% deposit. So for you, if that is your goal, you would have to literally start putting away money now towards the deposit. So how I usually actually got a client right now that she is in a similar situation, although she's not a student, in that she is putting away money towards the deposit of the house. So in a couple of months, she's going to go back to the bank and say, okay, guys, I've been putting this money, let's say 1,000 Rand. I've been putting this 1,000 Rand over 12 months. Does my 1,000 Rand qualify me for a 1,000,000 Rand house, for example? So you can start by actually having that plan in place, and that, okay, I'm going to put away X amount of money out of that 10 grand, for example. If you can, put away as much as possible. And then you build towards that, in that, okay, in a couple of months when you approach the bank, it's like, okay, first guys, I've put away money, I've got a deposit, so how much would I then qualify for after that? I'm assuming that, are you going to have help from your parents to get this rental place, or is it just on you?
Well, at this stage, I'm paying them to stay. I'm a bit older, about 30 years
Oh,
at this
okay.
stage. Yeah,
All right.
so I don't know, I could probably use these years I'm studying to put away money so that when I exit university, I've got a deposit
Exactly.
at least.
Yeah, that's it.
Thank you.
Sure, man.
Thank you.
No problem. It's not necessarily a financial based question, although it's tied in, seeing as a lot of the, or at least what I've noticed, a lot of the fears or the anxieties that men in general are facing is the unknown, fear of failure, not knowing if they're getting the right decision financially, or should I leave this job because to get this job, or should I leave this to do this?
Sure.
Oh, flip, I can't remember where I was going with this. Oh, yeah, making the right decision. So I'm studying, I've got a bit of a side hustle, and I had a full-time job, so 6 days a week, 10 hours a day, and that was absolute hell. And I recently resigned from the full-time job, focusing on the studies and trying to push the hustle. But the month leading up to that decision was one of the worst times in my life. And now it's been just about a week, and I'm very, I mean, I've put money away, I've saved for at least 2 months, at least if I'm cautious with my spending. And I'm stressing that not having that financial stability. Okay, every month this amount is coming in and I can put this away and do this with it and this and this.
Sure.
How do you suggest, like, especially for people that are for students, do you suggest focusing on the studies, maybe have a part-time job, but then you're not making more than 5,000 a month, and that's pretty much rent depending on where you stay?
I hear you. So divorce, that's a tough one to actually give a generic answer to. Also, I would need to find out more information from you as to what your expenses are, what you think your expenses are going to be for the next couple of months, what fixed expenses you have, what's variable, and then you would take it from there, my man. Looking at what you've saved, looking at what your side hustle brings in, if it brings in anything. You'd need to look at those elements to see how you navigate going forward. So again, sorry, but I can't give a generic answer to that. But my details will be shared, and we can link up and chat about it if you're keen with that.
No, sure, that sounds good. Just sidebar. Would leaving a full-time job like that, but replacing it maybe with a full-time job that allows you maybe 2 days off?
Oh, okay. So you're saying, so you left the work because of the 6 days and the 10 hours that you had to work?
100%.
I hear you.
Yeah, Mr. Tlhabane, I'm sorry
Yes.
if I can come in on that question, the concern. So what I'm going to do, I'm going to ask my colleagues to post on the chat the booking link to our psychologists and our student counselors. So because some of these questions, I see that they need, someone to sit down with a student counselor so that they can be able to figure out,
100%.
What will work for them. Yeah. And with that being said, Mr. Tlhabane, thank you so much. And we try to post some of the questions on the chat. If you are able to assist with answering them, we'll really appreciate it. And also to our attendees, if your question was not posted on the chat, please do not feel bad. We received over 1,500 questions and concerns. So we will make time to divide them accordingly so that they will be sent to the relevant speakers. And there's also some concerns which will also be sent to a psychologist or a student counselor. So if you get a call or a message from a student counselor, please do not be surprised, because it will mean that your question or your concern was more related to the student counselor, because we saw when we were checking some of the questions and concerns, there's issues of people that want to commit suicide and things like that, it's so bad, and especially issues of mental health. So we have received all your questions that you guys gave to us when you completed your registration, and those questions will be responded to. Just be patient with us. And also, as you can see, there is so much need and demand. So, Mr. Tlhabane, we will definitely have you back, and maybe just have you just sharing the whole session, and we'll also be guided by some of the questions that we are receiving. And on that note, please check on the pinned chat. There is an evaluation link that we request that you please complete it, so that next time when we have this type of workshop, we know the issues that you want us to address. So please go into the chat and look for the it's written DCCD client evaluation link. It's also pinned on the chat. Please complete that. Then we will also ensure that we bring to you whatever it is that you need.
Hi. Can I just give Mr. Fatone Makarane the floor to close for today's session? Thank you.
Thank you very much for all this. It was well received, I think, by our students as well as us. We keep on learning every day, and it's very interesting. I think I was laughing on with myself when Dr. Ijane was speaking about all those things, including Oratile, about finances, saying that people really need to know their wills, whether they're in the capable hands. We also, she mentioned things very interesting, which made me think that maybe there was a talk which says masturbation is like an algorithm. The more you do it, the more you forgot the real thing. But she made it clear that it's healthy and so on and so on. I think some of you might have learned a thing or two. Without wasting much time, I think first and foremost, I would like to thank you, Mr. Program Director Malesela. We appreciate you. The time you did not eat too much, you eat it a bit, but I think everything that we were doing, it was to make sure that students get the best of this workshop. And as such, there was nothing you could do. I appreciate you and keep up the good work. Without forgetting my colleagues, Mr. Mekwa, Gloria and Mekwa, you have worked so well as a team, trying to provide for us all the things that we wanted. The opening by you, Mr. Mekwa, it was well received as well. I think on my side, I think that's the way to welcome people. Gloria, the interjection, all the assistance that we're providing, Gloria, we really appreciate you for such as well, because without you guys, it was going to be very difficult perhaps. And even people are learning, it will be tough for them to learn, but having to learn from expert as well, it brings them to the other dimension. So I also think perhaps because there was a lot of talk, and John as well, before I go to our speakers of the day, John, I think perhaps we must have, based on what you have said, and I think they said they will also try to go with you offline and so on. I think perhaps we must have, because these are the safe space that students can, our stakeholders and students can talk about this. Maybe going forward, Gloria and Mekwa and the colleagues, we can rather also ask experts to talk about the issue of BEE and so on, triple BEE and so on, or whether it's still relevant in our times, so that we can be interrogating it, so that people can heal. You know, it's important. I don't think all blacks also agree with BEE. And I don't think all whites are against BEE and so on. But we need maybe perhaps to get a time wherein we can look back and check what can be the way to go when we have people who knows how this works, you know, so that we can also vent out and see how best we can work. This is a safe space. I think that is the best platform for us to do. And going forward, I think I'll start with the doctor, because we come after doctor. Dr. Ijane, you know what, these things of cancer, the cancer for male, it's a serious matter as well. And you gave us the information as well, as in the way that I was asking myself, you know, because I'm outdated. Mostly as a psychologist, I've got a lot of clients who have got sugar problems. Then the erection is not holding, you know, so they suffer from erectile dysfunction. And when you hear their stories, it's so painful that they no longer enjoy sexual encounters with their partners. And then perhaps maybe with your help, perhaps you can give a lot of people there. I think there's a lot of learning from people that they can share with others. How can they still enjoy sex while they have got those challenges of erectile dysfunction without using chemicals like the Viagra and so on? It's very important, because these are the topics that are not too well spoken about. And I think you also gave a referral of a pastor doing this and that, and all those things. If one look at them seriously, you can see Utini, they link together, because if you look at what we're saying, sometimes the financial problems, it can be, which has been mentioned by Oratile, can be as a result of causing mental health, which has been said by Will, because all those things, they are working together. You have a problem of finance, then you've got a challenge of erection, which is where doctor is coming in. Then it also affects your mental health, because you're no longer thinking straight. That's very relevant. Thank you very much, Doc, for that information. I think even next time, please come and give us that information, well-researched information. Ms. Will, as a professional nurse, I really appreciate you as well, because what you gave us is more than what we get from the clinics. Sometimes we are scared to even ask, you know, what is happening and so on. There is that thing, I think it must be re-emphasized. I don't remember what they say, infection after 20 or 40 years, or did I hear it wrongly? Maybe I might have read it wrongly, but Gloria, Mamukiti, you have got a role to play now about what they've said. We are going to have our own workshop. You are going to workshop me and other men in the group within the department, because I had something to do with infection after some time, which is very serious matter that we need to deal with. Thank you very much, Wile, for that information. Oratile, I think financial is a serious matter, because the more you have a problem of finance, the more you are also going to be affected mentally. I think when I was listening to Mugabe, his previous speech, he says to me, I might be quote him wrongly, but you will understand what I'm saying. He said, when you have got money in your pocket, you can go the whole day without eating. Even hunger respect you, right? But just stay without money, poverty. You can be dizzy from 6 o'clock in the morning. The whole day, you cannot even walk properly because of dizziness, because you don't have money. So money make the world go round. So that is very important. I think financial issues, we need to talk about that, because if you're not financial well, you are more likely to be affected mentally as well. And it can also affect your sexual health, because sexual health works because you are always thinking about problems of finances, then even your manhood or your womanhood no longer function properly. So thank you very much, colleagues. I will also thank myself for being given an opportunity to thank you, colleagues. And thank you very much. And have a safe journey, and dress warm. We love you to leave you. Thank you very much.
Thank you, Mr. Patwane Makarane. Have a lovely day, everyone. Bye.